yeah, friend. Now, in fact, the most interesting aspect of it is
am I daydreaming?
Captain, I said, how you do? I'm teaching me. Inti, I want to say, oh, you're Ghana near Atlanta. They developers, any cloud infrastructure in now India. If you speak to health professionals now, they've gone through a lot. In the area buy, no, they can say, okay, contract in a wu. They also hand the BBR over to the state. You know, answer na yen yebe who say when there was a way no any when I will say a forensic audit. Any year forensic audit boy. A year forensic audit we no captain name a free mobile na agro. For example, hardware say bia computers, laptops also 20 ade no. But bia also e bia ode be 100 de kono obekọ na 50. But bia say bia obeto HP laptops no obekọ na koto cheaper brands. In the analysis out of there, you know, now the gaps in the hardware and $80 million. $18 million gaps in Kwano. No. In the real way, you know, apart from Sir Bayer, Ukuwaka admit to say $10.6 million. I want Papa Noah on fire, Jumano. The real way, you know, Captain.
$10.6 million.
If you go to Kubo in the Facebook, I mean, people are watching. I can send you that. Oh no, I admit it. Apart from that, you know, you say software nankasa no, and yet abide there. Into the friend lens, light wave health infrastructure management, health information management system, and you'll be there. Into you can say, okay, you pet disruption there. You know, okay, we ask them no. You already say you sign BBA friend service maintenance management agreement with you for 2 years. So you be on social idea on and off. Nemo as part, yeah, because you know, I tell you no association on. I tell you no association off. As I speak to you now, for the past 2 weeks, association idea off.
Yes. Baba, come on, Akandoh. And I'm also telling you,
Atlanta. Anti every no. You catch say fa data ni bibia mayen as part of the contract. As I catch and say as part of the service maintenance agreement no. So ye issues of data and free more on sign. Again 450 now you see I verify. You sure say you verify 461. So we can't do this. Now what will you say?
Your friend say
Samson Jabba.
Otuko Jabba ne brother no.
Inti ye catch and say look, ye to me side any free. Na ye koso no. Me cheche beti fo nti ase. Ye koso no. Ena ye can say ye to me nyim free. But who say ade no was so your boss mu. Inti time bi opebia no association on off. But so what occurred to me ni say to me because say a patch as a state. There was a solution to the problem, and this is what is very important. The solution is say you beside say and then the idea be able to see one, it is because apart from breaches in the hardware, it is because software in there. And as I speak to you now, software what you games, Ghana Health Infrastructure Management System, on mine there. Quite apart from that, I was saying BBA a friend exchange and now say middleware as a vendor be a cry bar who plug it in the data in your logging into the middleware. It's a state no control over our data. A BM 450 in now so no ya the man nipa bako the tiny bako ni bufua the opebia no ye 500 na akano going forward no and also ebebiem am obia so obi o Ghana ni a o te Ghana mamu ha a no so e woni mu die no ono so anya ne chefa nti ye wo be ye 4 weeks plan the first week you know ye dey be rolling the teaching hospitals, regional hospitals and district hospitals na
where they be rolling me pay baby a wo kono
that is the most important aspect. And back could be more Okaya, Okaya, me can't say Bahono. Also, Oka say, Uncle Baby, I will be ano. You Google, you 2 years, waste system and tessa.
Nedia no yama no so ntesa.
The way the idea be say na tesa.
But no nedia na waje $177 million.
So wo
Bagana e wuska wo.
Wo tamale na se obi uba konfanoche ha, I konfanoche se kolebu a yentumi enya wo data as a matter of course. But this system, yes, that's how the system was built. Nti administrative. You know,
it's now as
I speak to you now, or minor any administrative access to the data and the service. But fortunately enough, data, for example, you reconstructed data, no, you reconstructing say the no. I would say claims in the brain effort through the national health insurance. Inti national health insurance no, omu database ni mo no, and you reconstructed data no. Now, after the last 3 days, I'm going to brief you, we've been able to reconstruct about 14 to 15 million of the data, about 72 million visits. So we are reconstructing. Or not there, as and when or panel, as I speak to you now, the whole system is down, it's off. If you speak to any health professional, Rebecca Chow say this is what we are going through.
Debut. Yeah. Come on, Akandoh. I'm can't some and country ben pa na wasa sisua ye bitimi esi na yeti omem ha na ya po mudin Ghana fo a ye wo omem ha wo ko hospital or medical records nyina no ehye kwabra na ibotom mo de Atlanta na enye se Atlanta hon court nimpo na de no wo esa so hosting wo India.
Yes, it's being hosted in India. That is the problem we find ourselves.
Say to President Kufuor medical data to be show India.
So that maybe a drone no as a state.
And to be my interpon fakwa.
Oh, I know there. So all the union and all stakeholders are on board. I refer to the AG, IOCO, all the security agencies are on board, and I can assure you that steps are being taken.
No, I can assure you the TBA show.
You see. Normally, but say unim say me nkasa sakwa. Asem way the area who muni say a sha said we were managing it well because that me person me ba bonte until say me solution because we ka we nyina awie no ye bisa say minister the aka problems nyina awie no into what is the solution. So we wanted to handle the solution. Unim be no mo ye. They were planting stories in the media. A friend mu be say ya Mosca. They are planting as if the ministry was doing something wrong. Oh yeah, omo de ka nti omuntuai nti na ya switch the thing off, assuming without admitting that there's an issue with abanya na abanya to see why and then now you go to court. You don't switch the system off like that. Switch it at the end off.
But your producer me na menti asem na Akandoh kana say na so Ghana
I think that we are the only stranger in Jerusalem. Because on faithful binuma discuss ya dear no ma uko social media as if say by the grace of God the Bible thing I be church the muma Ghana for
what's your cowboy din room
cowboy din room
COVID
cowboy din room out of the 11 million
COVID cowboy
no now in November National Health Insurance paid $5 million to the vendor. Records are there. We have records of the 11 million Bako I didn't from Ministry of Finance and the National Health Insurance. So the 11 million, it moved clearly 5 million there comes with date. So that date was in November. November, who was the head minister? November 2024, who was the health minister? Boy. And interestingly today, on the spokesperson for Lightwave, nobody is speaking on the Kasamon. Interestingly, he is speaking everywhere for Lightwave.
And Tim Pacho, Mamentia say say ya ka say no ade no I say ECG for about fi afechare katwom fin na ya dum light no fin na ya so enti data na eye Ghana for yen ya pomuden ho
state need access to the data and na so be captain mamenka we so nchiro obi be catch say captain server no kra no esi onua TV a be mane na da you bet me the server na be see dem but you don't have administrative access to the server. If you don't have it, you don't have it. Inti memo bi am that say oh at the end see hono.
Then na MPP for science contract we no moment say na national security for new.
So that's where we are. And yeah offer no class say look, you are ready. But one not per se you need to sign contract for na de aka no so no o sign ye ka ho so what I say but I dey said in previous so you say fa mfie miensa ye won and I would mfie num aye baby ya duru obi a be catch you say wa underperforming ndi de wa ye bia no fabra anka ye nhwehwemu kura wie and a gaps le o mu failing ye na say okay na to aso a different thing but nipa say with bad faith as and when no matter the level of provocation I just say yeah power oh bra panyin yesra wa so ade ne mayen a state should not run that way the running state is so we have to take a courageous and a bold decision. So I will say a question here. Near correcting all these things within a very short time. And I'm here, me will have me no kasa because normally a new amabagu one doson. Ye cleaning kakra. Now we cleaning no. So one come a Ghana for anti asia obiti baby or say mira on our boy. No, I turn it out, no be blame. And that's how you know before that's how they behave. What cleaning mess now? What bad now be cleaning no? No original high moral grounds. Or so munye we. That is why there's a need say if ever bontin never church mu actually Ghana for say the better ye ni the year for money name the solution and for me the solution is more important. Captain is dazed. So Captain, that is CCI piloting and normal Rich Hospital. Today they will be at Kolebu and work is ongoing and then by the grace of God we'll get out of this problem.
No, nti maba kufa do amane. Montrono. No, you see what the Montrono letter. Because $100 million there it will need a cabinet approval. Montro akufa do say asem we onim ho bi. Enti here otumfo medical record e wo bi ho. Otumfo medical record no. Vice President. Yey. Je kufa ukrom mahene. Wo abortion na akoye na wo DC no. Madam, sa abortion na aye na DC no. Medical record ni sha kwa bottom. And a sansu see India. Into what was se wa brodi. Chi no aso. As many prepare. No, many bre asana me yamade one hwe asema mekeka no. One hwe Mr. Shandoff Bema me query. Because it doesn't make sense to me. Medical records.
They are better no.
See, and now one kind crata ni medical records otumfo ka ho.
Asem way. It has taken me 5 months to come out and speak. Wow. Yes, 5 good months. We managed this thing for.
And I just $77 million.
All this on the crowd. Okoboy, Obi Sunday captain. Nemo Okoboy Akano. Last Sunday no, very good. Obi first. Oh no, admitted say. Yama papa no $76.99 million. Yes, admitted. Oh no, admitted say. Yama papa no. Yama no $10.6 million. I want to onye enwajuma. Kind. Oh no, out of Sasika we will trade $5 million. In fact, I don't know someone to cheer 11 million, you know, because 5 million there it is with dates, but the other one is not with date. It means to me who say bia I don't mind to try and sign a oko and that's on the tree and but as for the 5 million, I can put it, I can say it on record. Say on the tree. He himself go and read his writers. Onwa. And today he is speaking for Lightweight. Very interesting. In Ukraine, I minister for the whole 8 years. You were either deputy minister or CEO or a substantive minister. 5 to 4 years, La General Hospital went to me and we jump here a co-position up require press conference in La General Hospital within 10 months. These are the people we are dealing with. So if you are not quick to also explain one church more, you are jumping onto the high moral grounds.
Debbie, I do we are sending a new Kubo in the truck.
I'm sending out.
Debbie, you what? Debbie, we new Kubo.
I'm saying when the verified Facebook page.
Debbie, and you're on the Troy. Minjindi obi hacking the system ne Debbie na me ade na me kan we you back kakra maka say the approved $100 million scope covered networking of 950 health facilities training of health staff 150,000 workers and continuous support and maintenance services to date Lightwave has digitalized 4 teaching hospitals, 6 regional hospitals, 243 district and municipal hospitals, 2 psychiatric hospitals, 49 polyclinics, and 159 health centers. Now, Honorable, what can 100 for 950? Totally, why you assume? There be no boy in the trial. Oh, we're sure. Me, mumu dear. Me makao say o man we baby a aircon pamacho sa former president title na kuta Akufo-Addo mo me yankwaje ese agifini nsem
so
na yentro mo patro mo ntro Akufo-Addo mo ntro letter mo ntro asem we command say on responding as a former president dey share response on the member.
So Captain baby I want to know as much as me pese Ghana for better ase no dey pese you concentrating on. As for security agencies, on your majuma, AGB na juma. But me as a health minister, there me hear say at the end of the day, no say Captain no hospital, ubunya records near hell na bibia koso 101. That is my focus at the moment. But I say chechile mu magana fo nyina etiase. Nsa what say ya edu ba bia so cash and carry sign ba na amuntumi verify national health insurance card no e bia moti we. That is the problem because ni nyina no a part of the system. You know,
health insurance data no so on ho.
Health insurance and also an integral part.
Our copy.
An integral part of the system.
Our copy can. Our copy and only copy.
And also
Honorable, our health insurance data now only.
That data you know, only quite a different national health insurance. Only a different national health insurance. So that is where we find ourselves, and yeah, very reasonable. We've been very diplomatic. In some cases. We brought other people in. Yeah, the man for crab by to talk to him. So we are Ghana ni inti baby edruno. But you who say as a state, young kosum po bichao. I will say state and ankasa so own on ankasa software. They own your system, they protect it BBR. So that's where we are, and I can assure you the piloting is ongoing, and health workers are very excited about the outcomes and all that. And we expedite action. You better say bit me intent magana for you so I won't. The captain, what they always say, said, "Yeah,
me without me, ministry bisa. How we bisa then? Recommendation. Recommendation. I recommend that the Chief of Staff intervene to mediate between the Ministry of Health and Lightwave eHealth Solutions Limited. A fair, transparent resolution will protect Ghana's investment. Safeguard national health data.
Safeguard national health data. Safeguard national health data.
And prevent needless duplication of efforts.
I mean, that's what the Kuba is writing. I wish I could kind baby on one because I admit it say, Yatia says Kano Ediama. A light wave, you know.
Yes. Oh, that's something. What can't trust? I approved 100 million.
There's another portion that says that. Tia, or say payments have been 62% from Ministry of Finance and 38% from National Health Insurance Authority. Totaling $76.99 million paid and 23 million outstanding. Inti hano ono aje atum se 77 million. Mba mchame bwana. Me na mchoye. Ntono ankasa aje atum. Afeti, o say as of December 2024, our reconciliation showed an unauthorized advance. Ono na choyo. Unutilized advance of 10.6 million yet to be expended by the vendor. Ono a boy. But I can't tell you
not Troy.
Onwa in his own write up. Yet to be, and I yet contract the BSA, Jessica Nakoyo. We are near evaluating and so okay, scared. Onwa was a 10 point, Onwa and say 10.6 million over panel. Yet or social then off and on. Yet the whole system is up, down. Onwa Okoboy, the immediate past minister. Exactly. You see, how the only question there, I'm going to make over before one.